People can have no symptoms to a COVID-19 infection, while others have severe and long-lasting effects. Lung treatment and rehab are being used to prevent chronic disease. Dr. Gurbinder Sadana, a pulmonologist at Pomona Valley Hospital Medical Center, discusses the effects COVID has on the pulmonary system.
COVID attacks nearly every single organ in the body. The most effect is what we see is in the lungs, because it's an airborne virus and it goes and enters through our nose, mouth, etc. And the first major organs to come in contact is the lungs. The lungs are the most sensitive, in fact. The lung is, of course, a life support organ, like the heart is. So as COVID hits the life support organ, it immediately starts multiplying and starts consuming nutrition from the lung and continues to cause further damage.
There are many factors affecting the severity of a COVID infection.
COVID initially manifests, the spectrum could be mild disease to very severe disease. So it all depends on several things. But what we see the worst are those who have high comorbidities, like if they are older than 70 plus, number one. And then they have diabetes, or if they are overweight, their body mass index is very high. So those manifestation is very high, and it's probably due to some immune impairment in these folks or in these individuals. We are still in the process of learning more and more as day goes by about this, and I think it will be some time before we get a handle of the entire picture of the virus.
Dr. Sadana reviews the use of ventilators and other treatments to fight COVID-19.
We found that the ventilator was not really the key to saving the lives. There were other non-invasive methods which were applied, like high flow oxygen, but excessive amount of oxygen was given to keep the patient going and alive. And once you intubated them, put them on a ventilator, the prognosis was not very good. So it was an ongoing process, and it took us a few months before we got a handle on some of the things of therapy. And then the drugs came out, and well, they are still working on the drugs. We do have a few, if they are initiated early on, do make a difference, but in the late stages, even they are not very helpful. Our protection is take prophylaxis against the virus. And the biggest achievement has been the vaccine currently. However, that doesn't mean that we stop using other precautions like using masks, avoiding certain scenarios like congregated gatherings where a lot of people are close to each other. So those precautions will continue and are needed to be continued. These precautions are definitely effective and have enough anecdotal evaluations been seen which has proven so.